it's Khaki. Today, I want to talk to you about being a pre op. I realized I have not covered this topic in a long time, and I get a lot of questions from folks who are in the planning stages or working on insurance coverage. So, I want to go back and talk about that. For those of you who may be new to my channel, let me tell you a little bit about myself. I am 3 years post op from RNY, also called gastric bypass surgery. I have also had 2 rounds of skin removal surgery. I have lost right at 142 pounds and have maintained that for about a year, give or take a few pounds. I'm also a nurse practitioner, primary care provider, so I have a little bit of both patient experience and medical experience in treating bariatric patients. So, first off, if you're pre op, congratulations! You have made truly one of the best self loving decisions that you can make. I know for myself, having weight loss surgery gave me a new life. It truly did. That's not a dramatic thing to say. It is true in so many ways. So, first, congratulations on making that decision for yourself. So, let's talk about what you need to be doing in this pre op stage. First off, follow your pre op diet. I know it's hard. My program required a 2 week liquid diet. The purpose of this pre op diet, whatever your program wants you to do, is to shrink your liver. Your liver lies in the right side of your abdomen. Getting that liver shrunk, almost all of us who are obese have a lot of fat around our liver. Getting that fat melted, for lack of a better word, and out of the way makes your surgery much safer, much easier for the surgeon, and makes your recovery easier because there's less internal organs to move around. So, as a result of that, you will have less post op pain. I know it's hard, but there is a reason. It's not to test you to see if you can adhere to the bariatric post op lifestyle, it's a safety issue. The same with that post op diet. Whatever your plan calls for, mine was a 2 week liquid post op diet. So I had basically 4 weeks of liquid only. I was allowed pre op a little bit of berries, like a quarter of a cup twice a day, but pretty much liquid. Do what they say. They didn't just draw this out of thin air. There is scientific research behind why you need to do this pre and post op diet. Next thing, prepare. I found it so much easier for me post op if I was truly preparing pre op. With my liquid diet, I wanted to have some variety, not just be drinking store bought chicken broth. So I went to Pinterest. I searched for bariatric broth or post op broth recipes. I found several with a lot of different variety. And I bought on Amazon 1 cup trays that look like ice trays, and each well had 1 cup. I made up several batches of several different types of broth, froze them, popped them out of the tray, and put them in gallon freezer bags. Then, when I was in the pre op and post op stage, I had all the variety with none of the work. I would have some French onion beef broth. Then, a couple hours later, I would have a Thai chicken broth. It really kept me satisfied. I can't imagine going through that 1 month of liquids with just store bought broth and protein shakes. That leads to another thing. Don't stock up on protein shakes for your post op. Your taste is going to change. Things that you might be able to tolerate pre op, you may not post op. So just get a little bit a few protein shakes so you'll have some variety, but don't buy case upon case of protein shakes. I know for me, post op, I couldn't tolerate a protein shake. They made me so nauseous. My dietitian recommended I drink just a shot glass full at a time if I could tolerate it, and if I couldn't, not to worry about it. So don't invest a lot of money in those protein shakes. They are so expensive, and you don't want to be stuck with something. I ended up giving away a lot of protein shakes that I had bought ahead of time. My puppies are playing back there, sorry. The other thing I would advise you to do pre op, research, but know your sources. If your source is TikTok and it's someone who is selling a vitamin supplement or someone who is pushing their own program, just keep that in mind. That may not be the best source of information. So do your research, but know your sources. Look at the ASMBS, which is the American Society of Metabolic and Bariatric Surgeons. Look at Obesity Help website. And most of all, rely on your team, your bariatric team. They are the ones that you've entrusted in this journey. So they should be really your go-to for source. Next advice, wrap yourself in bubble wrap. Honestly. Hang on one second. Let me tell these puppies to quiet down. I'm back. I told them, but they don't listen, so forgive me. So as I was saying, wrap yourself in bubble wrap for that post-op period. You are going to be so limited at that point in what you can eat and drink. Don't torture yourself. This is not the time to go to a party where there's going to be food served. This is not the time to go to Buffalo Wild Wings with your family and sit there and watch them eat the things that you want. I am a big foodie. I love to eat out. I love to try new foods. But I did not step foot in a restaurant for probably 2 months after my surgery. Because why would I? It was going to play games with me. I was going to feel deprived and question my choices. So if you have the option, avoid those circumstances. The other thing that goes along with that bubble wrap, anyone who is not supportive of your journey, minimize your contact with them. I realize that sometimes that's hard, but that is a choice that we have in most cases. If it is your spouse or a close family member, be very vocal. Tell them, I have made this choice and I do not want to hear this from you right now. And when they start minimizing what you're going through or being negative, walk away. Big, big key there. We don't have the choice in how people treat us, but we do have a choice in what we put up with and how we react to it. Next thing, that first few weeks post-op, don't worry about protein. Yes, we have guidelines. We have minimums that we need to meet. But in those first few weeks post-op, you're not going to meet them. I can just tell you, you're not going to. And it's okay. It's not going to cause a protein deficiency. It's not going to cause all your hair to fall out. You're going to have hair loss no matter if you do everything right, most likely. But you don't stress over. I know in my first month, I got about 20 to 25 grams of protein in a day, and I did fine. What you do need to stress about is hydration. The number one cause for ER visits and for hospital readmission in fresh post-ops is dehydration. That is where your focus needs to be. Sip, 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 sip. This leads to the next thing. Before you have surgery, I would suggest you find an IV hydration center somewhere close by. Touch base with them. Find out what they offer, what their hours are, what the cost is. For me, I ended up needing IV fluids. I became dehydrated the weekend after my surgery. Thankfully, given my profession, I had access to IV fluids. My sister is an RN, so she was able to start an IV on me and hydrate me. But paying $100 for a bag of fluid somewhere is probably going to be a lot cheaper and a lot better for you than going to an ER and having that huge bill. So just preemptively think about that. The signs and symptoms of hydration: weakness, headache, fast heart rate. If you start to feel those things, might be a good idea to get a little IV fluid. Reach out to your team, of course. See what they want you to do, but just think about that ahead of time. Have that plan in place. Another thing, stay in touch with your team, guys. It is so important. I get very frustrated with my patients who are post op and come in, and they will come to me as their PCP, and I will say to them, "How long has it been since you touch base with your bariatric surgeon, with your bariatric nurse practitioner, with your dietitian?" Well, they wanted me to follow up at 6 months, but I was doing okay. No, no, stay in touch. Whatever they want you to do, however frequently they want you to follow up, it should be at least a yearly after. It doesn't matter if you're 10 years post op. Having said that, if you had surgery out of the country, or if you move, or if your insurance changes and you don't have access to your original team, find another one. Go online, find bariatric surgeons near you, reach out to them, see if they're in your network. Most bariatric surgeons will see other people's patients when they get further out post op. They don't want to see somebody else's patient who's a fresh post op, but they're willing to monitor your labs. They're willing to give you access to the dietitian. They're willing to be there as your support system. Find somebody who can do that. Another thing, find some online support. I know my particular bariatric team, they offered telehealth support groups that were mandatory. After that, they really didn't give you much in the way of peer support. Find some peer support. Again, with a grain of salt. If it's a Facebook group that is like a post op Facebook group with 25,000 members and no experts, keep that in mind. That's probably not the best source of information. I am a big believer in Berry Nation, which is a paid support website. It's about $30 a month, and they have experts. They have dietitians, they have surgeons, they have therapists, mental health professionals, they have nurses that are resident experts that interact, that have support groups, that have classes. You can pop on there pretty much any time and take part in some type of support. They have a message board that you can post things, that you can rant, that you can ask questions. It is a very thriving support network. So if that's financially feasible for you, I would highly encourage you to do something like that. So guys, I think that's really all of my pre-op advice. I would love to hear, where are you at in your journey? If you're post-op, what advice would you have for a pre-op? What did you not do that you wish you had? What do you know now that you wish you knew then? I would love to hear from everybody. I would love to hear any video suggestions, any questions that you have. I want to talk about what is helpful to you. I hope everybody has a great week, and I will see you next week. Bye.